Today we have Dr. Jan from CalfCare here to talk about calf care and management, better performance. You're up.
All right. Thank you, Catherine. Thank you, Mark, and the rest of the people at the Elkhart County Cooperative Extension Office for inviting us to come talk about something that we're pretty passionate about. And wanted to have a few basic overview things to talk about. I am Dr. Jan Gawthrop. I'm veterinarian at CalfCare. CalfCare is a veterinary practice at North Manchester, Indiana. There are 5 veterinarians in the practice altogether. 3.75 technicians. One of our technicians is in her 3rd year of technician school, so she'll be joining this professional staff soon. At CalfCare, we predominantly look after people who are raising small calves. Mostly people who are purchasing large groups of calves from order buyers or directly from dairies. They're arriving at 3 to 7 days of age, and our clients will keep and care for those calves until they are anywhere from 3 to 5 months old generally. We do also look after feedlots because some of our producers buy the baby calves and take them all the way to finished beef. We look after some cow-calf operations. We consult on dairies when they're having calf raising issues and so forth. And we do get involved in some small ruminant sheep and goat work. And one other special ruminant we have is the reindeer that lives just outside of North Manchester, about 3 miles. In our work, we travel quite a distance. We cover all of Indiana and the 4 states that surround Indiana: Ohio, Michigan, Illinois, and Kentucky. We are licensed in all states, and we call upon our clients in those areas. In the process of doing this, in a year's time, we estimate that conservatively we have some kind of influence on as many as 700,000 calves and cattle each year. So I and my staff have a lot of involvement in calf raising and in beef production in general. And it's good to have a chance to spend some time trying to share that information with everybody here. A little bit also needs to be said as we go about the meeting today, that if somebody has a specific question about, hey, my calf has this kind of sickness going on, what do I treat it with? We can't talk about that because we at CalfCare try to hold very close to the federal regulations requiring that for us to dispense prescription medication, we have to have what is called a veterinarian client-patient relationship. In other words, we need to know the client, we need to know about the calf, and we need to be able to communicate back and forth to deal with the condition at hand or to deal with any kind of condition that may come up after that fact. And so while we won't talk about specific things, I will spend a lot of time talking about those management things that can be done and implemented so that there isn't the need to treat that individual calf or a group of calves. Naturally, in our work, we still have those situations, unfortunately, when we need to respond to sick animals, but the majority of our work that we call upon farmers and our clients, most of our work is done in an attempt to do everything we can to teach our producers how to manage the calves and cattle in such a way that they don't get sick. And so because of that regulation, the VCPR regulation. We can't discuss individual cases. We can't discuss this animal and what we treat it with because I haven't examined that animal, and it's not possible for me to make a recommendation to anybody specifically. There are lots of different types of calf raising, and so we'll try to touch on each of them briefly, but in fact, a little bit of explanation. If you would go back a slide, I need to talk a little bit, and I usually introduce this cow to everybody when I give a talk. And the cow up in the corner is Pica Prince Harris Beth. And in 1957, just outside of Etna Green, Indiana, she lived on a farm with me, and she was the highest producing milk cow in the United States. She gave a ridiculous amount of milk, 28,000 pounds, a little bit over that in the course of a year. And of course, those of you who are dairymen and understand, she's still a good cow, but today she might be average or maybe a little above or below average on a lot of herds. But we've come a long way in understanding production and so forth. But I just have to let you know that my roots began in and around cows and calves, and being involved in that hasn't changed in many, many years. So the next slide, please. So there are six topics, six chapters in the book, so to speak, on just controlling disease in general. And this is actually true whether we're talking about calves or pigs or humans. If these principles are put into place, generally there's going to be good health, good production, good performance. And this all seems so basic and so it seems too easy. It seems that, well, there's got to be more to it than that. Generally, my assumption is that the most dangerous germ on every farm, the one germ that causes more disease than any other, is the two-legged one. In other words, us. We're the most dangerous germ on the farm. And if we can do a better job of looking after this list of six things, then we do a much better job of disease management. And I'll try to touch on each of these six things as we go about the different production systems that involve raising calves in one form or another. So if you would go to the next. And so just real quick, and I present this to students or to producer groups or whatever, this beautiful picture doesn't just make your heart warm to see that mother cow and that baby calf, and that is just a beautiful picture of disease being passed on to a young calf. We like the looks of that, but look a little closer, and that, first of all, the steam coming off that calf, so it's chilly in there, and that's not all bad. But the bedding's not very deep, and in fact, if you look pretty close, it's pretty wet and dirty. And one other thing that I'll talk about several times in the course of this talk is that loving mother licking that calf and being around that calf is passing on a lot of disease germs to that calf. And so when I'm managing or instructing dairymen to manage their calf crops more efficiently and more easily controlling disease, is that, first of all, that needs to be a much better maternity pen than it is. And that cow needs to get away from that calf because she's passing things on to that calf that we don't want that calf to catch. So if you would, let's go on to the next slide. Let's talk about these things. So let's talk about, for those of you who are dairymen, the calves that are born on your farm. Some of this seems so incredibly basic, then you'll go, well, no, I know all that stuff, and you don't need to tell me all that stuff. And my response to dairymen when we're having this conversation and they have that attitude is, if you know all this stuff, how's come you're not doing it? The birth area needs to be cleaner than what we just saw. That calf needs to be away from that cow as soon as possible. That calf is not going to stand up and not going to nurse colostrum from that cow. And if that calf did, it'll get its lips on a very dirty udder, most likely, and that's not healthy. The dairyman is nowhere to be seen in this picture, but we're going to assume that he's going to do a good job of dipping the navel and getting that taken care of and blocking that entrance of disease organisms entering into the calf circulation. And again, we're talking about sanitation and how that affects what goes on with that calf. And then there needs to be good clean feeding equipment. We have the ability to do so, and we frequently do so. Look at the bottles that are being used to feed the calves. If milk replacer is being mixed, is that tank clean where the milk is being mixed in? And then, is the feed clean to begin with? And it is a common practice in the dairy industry to feed non-sellable milk to calves. That can mean, good transition milk that's rich in antibody and rich in nutrients and so forth, or it can mean hospital milk, which is coming from cows that have diseased udders. And now we have a feedstuff that isn't clean. Dairymen, a lot of them do a good job of pasteurizing the milk, but let's play a numbers game here. It is acceptable, somebody has established this figure, it is acceptable for there to be as many as 100,000 bacteria in a cc of milk milk. And you say, well, I pasteurize my milk. Well, that's all good. Pasteurization at best is 99% effective. And so if you have badly contaminated milk and there is 100 million bacteria, and that's not an exaggeration, we have found more than that in doing colostrum and milk testing. If there is 100 million bacteria in a unit of milk, and you pasteurize it, we're now down to 1 million, which is 10 times more bacteria than should be fed to the calf. And so how do we knock down the bacteria? It's through sanitation. That milk it's being collected, and that includes colostrum. As it's being collected, it needs to be taken care of as if it was going into the sellable milk channels. In other words, it needs to be collected in a clean situation, in clean milkers. It needs to be gotten cold as soon as it can possibly be gotten cold. If it is colostrum, it needs to come out of that cow as fast as we can get it out of that fresh cow and into that calf without going through the process of chilling and then reheating and feeding it to the calf. And oh, by the way, where's the calf all this period of time? Is he living in a clean environment? Not only that dirty maternity pen that we saw, are you putting him into a clean environment where his pen is going to be where he lives? One of the other principles of disease control in a dairy is isolation, and I've harped on it probably long enough. Get the calf away from the cow as soon as possible. And then isolation away from other calves. And that can mean not only separation in their living environment, maybe they're living in a hutch or they have an individual pen, and that is all a very good thing. But we have to look at what else is going on in that environment where that calf is at. And we'll talk about the environment a little bit pretty soon. But I don't want to be in a situation where this newborn calf is going to have exposure to calves that are considerably older than him or her. That we don't have older animals that may be incubating diseases now living adjacent to that newborn calf and passing that disease on to them. And we'll talk about all in, all out management of populations and so forth as we go along. So nutrition, cow's milk is perfect. It's ideal, right? Well, not really. There are things that the cow can't make. that a calf should actually consume. Milk is not very high in B vitamins. There are some amino acids that are actually lacking in milk. And milk replacer, there's things in milk replacer that the cow could produce and is lacking in milk replacer. So nothing is perfect. And yet if you go with a commercial milk replacer, number one, we know it's clean to begin with. We know that it's probably supplying some things that the cow can't supply. And it oftentimes will give better quality nutrition to that calf than the one that is just only receiving milk. You want to get really good at doing this? We make a blend of milk, cow's milk that has been kept clean and milk replacer, and that becomes a more balanced diet than just one or the other. A couple things about feeding milk. People that are feeding milk replacer oftentimes want to not feed milk for a long enough period of time. The calf needs to be consuming 3 pounds of grain before we begin the weaning process. Those people who have waste milk and ample amounts of cow's milk available to them oftentimes want to feed calves longer than they should. There comes a time in the calf's life when it's actually beneficial for him to be weaned and get established on a good grain diet. And that's the next point, is it needs to be a good quality grain. The stuff that the older calves don't want to eat is not what you feed the baby calf. If a newborn calf cannot readily digest forages, I really don't want any forage going into that calf. Maybe he's picking something off of the bedding, but that's not even ideal. But no roughage prior to weaning, but after weaning, to me, roughage, some type of grass hay or even yellow wheat straw is a good thing to be feeding as part of that calf's ration. There's a lot of specifics on types of milk replacer. There's a lot of specifics on different types of grain, and that is a case-by-case situation that you should be talking to your veterinarian or whoever your attending veterinarian is, or to CalfCare. We can give you some recommendations on some do's and don'ts on proper nutrition. Have that calf living in some place that's good for that calf to live. Clean and dry is the thing that we constantly harp on, and every dairyman, anybody that raises calves will go, yeah, I know that. Yeah, I know that. Well, then why aren't you doing it? Clean and dry. That disease germs love moisture. Keep that thought in mind. They love moisture. They love a good, wet, stinking bed for that calf to lay in. Those germs love good, wet, stinking air for those calves to be breathing in. So they need clean, dry bedding, and that bedding needs to be added to or changed frequently to keep it dry and to keep it fairly disease-free. Likewise, the air there needs to be exchanges in that calf's air. You're raising in hutches, hey, that's fine, but make sure the back door is open so that there's ventilation through the hutch. And people who know me very well have already heard this statement: calves can stand cold, they can't stand wet. And that means they can't stand a wet bed, they can't stand wet air. And so if you're raising in hutches, get the doors open so air can move through that hutch. If you're raising in a barn, it needs to be a barn where there is exchange of air frequently, and not some damp, wet corner of the barn that you can't use for anything else. Let's stick the calves in there. Okay, well, you're going to be meeting the veterinarian pretty soon if that's where you live. Fly control is an important thing in baby calf management. It's becoming very apparent to us here in the last couple of weeks as the flies wake up and start breeding and start becoming more plentiful. A good fly control program is more than just pumping up the sprayer and splashing some insecticide around the barn. Again, work with your attending veterinarian or fly control specialist to put together a program where you're looking at how you control the breeding and growth of the fly population and how you control it. Using insecticides is kind of the last option that you should go to. there's lots of things that can help control the fly population without spraying and exposing the cattle to insecticide. And the last thing is space. Give the calves enough space, enough room. And that goes back to the fresh air thing and the dry bedding thing, and goes back to the isolation thing where that calf needs his space and not a lot of other foot traffic going in and around his space. Some people are raising calves in small groups on milk bar feeders and so forth. That's fine, but establish enough space for that population of calves, and then you keep that population of calves as one unit, and you don't put in and take out as you constantly go along. So next slide, please. Yeah. So vaccinating cows on a dairy especially, and in beef cow herds too, the immunization program for baby calves actually starts with the dry cow. And I won't recommend a vaccination program to anybody today, and I wouldn't recommend a vaccination program to anyone without finding out more of the operation before we start talking about vaccinating. Again, are we doing all the other 4 things previous correctly? And if we're doing that, then maybe the need for vaccine is not all that great. I'll just interrupt here a little bit and say a fun exercise that I have with farmers is to say, okay, how are you going to control this disease if we didn't have drugs and we didn't have vaccine? And most farmers get a blank look and go, well, I'll give them a shot of this. No, you don't have drugs. Well, I'll vaccinate them for this, and this. What if you have no vaccines? How do you fix the health problem if you don't have drugs and vaccines? And it's important to think about that, in the fact that while there's good vaccines available, they don't cover everything. And then as we start talking about medications and so forth, as far as antibiotics go, most of us in our lifetime will never see a new antibiotic. And so it becomes very important that we find how to use antibiotics sparingly, to use them correctly, excuse me. And to use them appropriately, and to find ways of managing and taking care of the animals, the calves, without necessarily using drugs. So vaccines, yes, we use vaccines, and we recommend vaccines pretty heavily to our clients because there are a lot of diseases out there that, even though management is good, may still come through. But the whole program, especially on a dairy, starts with vaccinating the dry cow, and you focus the dry cow vaccination, if it's being done for the sake of the calf, on what are the diseases that are currently on the farm, and what are the things that are challenging those calves in your management system. Keep in mind that every dose of vaccine, whether it's given to the dry cow or if it's given directly to the baby calf, every vaccine you give is stealing energy and performance away from those calves. And so you don't give extra vaccines if you don't need to. So is the vaccine needed? When does it need to be given? And is it really necessary that vaccine is used? That's a discussion that everyone should have with their attending veterinarian, and focusing on the diseases that are current on the farm and what we need to do to try to control those diseases. Medication. You need to use medication when the first 5 things that we've talked about today have failed. And then what that medication you use then becomes a one-on-one conversation with your attending veterinarian. So let's go on to the next slide. So there we go. Baby calf. Well, maybe not a baby calf, but let's talk performance. That mom is somebody special, let me tell you. So let's go on and talk about how do we take care of that tiny little fellow there in the picture. Sanitation in the beef cow herd is a lot easier than the dairy cow herd, partly because we're spread out. We go back to the isolation in the beef cow herd is a great advantage that they have in the fact that those cows are calving in an isolated situation. And because of that, the sanitation and beef cow herds is generally quite good, unless there is a decision that we're going to calve those cows in a barn or up close to the barns or in a small lot where is our calving pen and so on. And when we start doing that, then you start having issues all over again about crowding, and sanitation isn't good. As much as possible with beef cow herds, get them out, get them away from the barn, have a wide protected area where they can have those calves. For the most part, those beef cows know a lot more about having the calf than what we know, and they'll be much better off if we, for the most part, leave them alone. If it's safe to do so, in other words, if you're not going to get injured by the mother cow as you are working on the calf, try to dip the navel on beef cows' calves if you can get a hold of them without getting hurt. Isolation, as far as controlling baby calf diseases in the beef cow industry, is a great healing thing and a great way to prevent baby calf diseases. Get them out and get them away. If possible, if there are sick animals, a sick cow calf pair, maybe they need to be sequestered in the barn away from the main population of the other cows calving. If we do get into an episode where there's a diarrhea problem or an epidemic going through the beef cows calves, then we have to start looking at isolation as one of the means of controlling that diarrhea disease. The last 7 calves we've had, the calves get diarrhea on the 3rd day or something like that. Okay, well, the solution to that is the next cow, the calves, needs to calve somewhere far away from where those other cows are at. Isolation is a means of controlling disease. And again, if you're buying new stock into your beef cow herd, you want to try to do that not at calving time, not bringing them into the environment where they maybe have some diseases that are current that they're bringing with them that you don't have already on your farm. Let's go to the next slide. So nutrition in beef cow calves, that's the mom's job. And for the most part, it really is. And you may want to consider using mineral supplements like Bosi or Multimin when the calf is first born. Again, if you can administer it to the calf without getting injured by the cow. And then one other thing about calf nutrition in the beef cow world is that I do encourage creep feeding those calves prior to weaning, such that the calves are not immediately going from cow's milk and forage grazing and immediately going on a grain diet. If you can creep feed those calves 2 weeks at least before weaning or even longer, then that gives you a situation where that calf is more adapted to the grain diet that it's about to consume. Probably one other thing, and it seems indirect, and yet it isn't, is that nutrition in that baby beef calf really comes down to how you're nourishing the cow. And won't go into that in depth, but there's been a lot of good things happen when beef cow producers start developing a method by which a small amount of energy concentrate corn can be administered to the cow's diet while they're out on pasture, just on a limited basis, a small basis. It increases milk production in those cows. It increases the rebreeding of those cows more effectively. And that extra nutrition the cow gets, a lot of it comes down and ends up getting to that calf. We saw the picture of the red cow and the huge calf that she raised. And if you look at the body condition of that cow, now I'll guarantee you, she didn't do that strictly on grass. She's had some feed administered to her, but it shows in the quality of the calf that she's produced. So going back one slide, to the environment. Beef cow calves have a great place to live and grow up and be disease-free if they are spread out. And so the isolation that most beef cow operations afford is because they're out long ways from where the germs are living, where they're concentrated. But you do need to look at controlling the environment, like around waters, around feeders, the bale rings and so forth. They need to be moved in such that the cows and the calves have this sounds familiar, a clean, dry place for them to be living. Need to supply some source of shade in the summer. And again, it needs to be done in such a way that you're now not concentrating all the cows and the calves under the single tree you have in the pasture. But some type of portable shades can be built. And if you need instructions on that, please contact us. I can give you some information on how to build portable shades for cow calf and stalker calves too. Likewise, there needs to be some type of protection from the calves. If you're calving in the fall, those calves are going to be following the cow during the winter, and there needs to be some kind of protection from wind and snow. Not necessarily barns, but some way of at least having a windbreak in some place where they have some type of protection where they can be out of the draft and reasonably dry. And this is pet peeve, is that somebody says, well, I'm calving in January. Why are you calving in January? There needs to be a good reason for doing that. And some people have good reasons, but for the most part, have those cows dropping calves at a time of the year when it's most conducive for the well-being of that calf. Fly control is an important thing in the cows and the calves, and we could have a whole nother seminar on just that alone. Again, it needs to be an organized program that you're doing to control flies. Can be done through periodic sprays, the use of fly tags in the ears of the cows and the calves. It can be a means of having dust bags put up strategically so that the cows and the calves have to use the dust bags as they go through a small area heading toward water or heading toward mineral. One addition, if you've been reading the paper and studying, there's a tick that has come into the upper Midwest here that carries a disease that is not treatable. And so as we control flies, to some degree, we're also controlling those ticks. And maybe more than ever, it's necessary to have a good program where you're not just, you've got a dust bag hanging, but it's not where the cattle have to use it, or we only spray the cows if they are just covered with flies. Oh no, start long before they get covered with flies. There needs to be a program, and we can help you direct that, but I'm sure a lot of other attending veterinarians can do the same thing. So vaccination with the beef cows, calves, just like the dairy cows, calves, it begins with the dry cow. And vaccinate for those things that are current important diseases. Calf diarrhea is common in beef cows, calves, and it's really hard to treat those calves because they're running with the mom, and the mom doesn't want you messing with the calf, and it's hard to control that. So there may be some need to have that in the vaccination program for the beef cows when they are anywhere from 4 weeks to 8 weeks prior to having calves. Some vaccines can be given at birth to the baby calves, such as clostridial diseases and some of the respiratory diseases through either injection or intranasal vaccines. Again, you have to do it in a manner where you're going to stay safe, because those mama cows don't really appreciate you messing with their calves, at least if they're good cows. Even though we're talking baby calves today, looking forward to that beef calf getting ready to be weaned, there's lots of different immunization programs that the calves can go through. It's getting to be more and more important to have some kind of early calf vaccination program, in the fact that there's been an increase in incidence of respiratory disease in calves that are nursing the cows, calves that are 2 to 4 months old, and there maybe need to be something done for that, but that comes back to a farm by farm basis. Are you having a problem with it? And then can an immunization program be put in place for those calves? Or can there be a good immunization program put in place so that when you wean the calves at 5 to 7 months of age, they have some protection as they go out into the market channels or as you feed them out yourself? Medication, you've heard this before. If you're needing medication for these things, then somewhere along the lines, maybe we need to tune up what you're doing as far as the other items that we've talked about. And again, that's something for you and your attending veterinarian to talk about. So next slide, please. So this is largely what CalfCare does for a living, is looking after these guys. This picture is a little bit old in the fact that anymore, a lot of the calves we see are not black and white spotted anymore. They are solid blacks that have are part of a program where dairies are now breeding their dairy cows to beef, crossbred beef bulls, so as to generate a better carcass and a higher value in the marketplace. But this is largely what we work with. Every calf has his own space. He has bedding underneath of him. He has ventilation. As you can see, there's a lot of sunlight coming in that barn. So when you show the next slide, I'm getting ahead of myself a little bit there. So shipped in calves, sale barn calves. A lot of our clients are working with integrators or dealers where they're bringing in, let's say, 200 calves at a time. It is very, 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 did I mention it's very important that the barns are clean and disinfected prior to the calves coming in. Manure is removed, disinfecting is done. The barn is allowed to sit because time and sunlight and heat and cold are good disinfectants. And then the barn is clean and dry and bedded and waiting for the calves to come. That is a good disease control process. Likewise, anything that calf's going to get his mouth on and be exposed to needs to be washed. That includes feeding buckets and gates and pens, etc. And then the other issue on sanitation is the cleanup process that people do or don't do as they're cleaning up the feeding equipment between feedings. The nipple bottles, the nipple buckets, the open buckets where calves are being fed out of needs to be sanitized properly between feedings. To us, that is more than a bleach and dish soap disinfectant. There are commercial disinfectants and sanitizers that are much more effective at removing all of the milk residue that was in the bottle or the bucket. And it's very good at killing the germs so that when the calf gets his next meal, he's not consuming a bunch of germs that grew in that bucket, that the flies brought to that bucket over the 12 hours that were between feedings. Isolation, it is a very important thing that these operations do an all-in, all-out kind of production system. Even if you are a hobbyist and you want to have a small project for the family to do during the summer, get all of your calves in one package, one time. Don't buy one at the sale barn this week and 3 weeks later buy 2 more, and then 2 weeks after that buy 1 more, because the disease processes will build and become a very difficult thing to manage. All in, all out is a method of controlling disease that has been employed by the hog industry and the poultry industry forever, and they are very effective in controlling disease largely just because of that practice. And again, it goes along lines that you don't have older calves sharing the same airspace as the babies. Some people have tried to do a continuous flow situation where, every week they're bringing in 8 or 10 or 50 calves, and they'll put them in the same barn where there's older calves. It never works. I tell my clients that do this, why don't you just go ahead and shoot yourself now, because you're going to do it later if you try to do it this way. It will fail. And by sharing the same airspace, you say, well, I'll have the babies on this end of the barn and I'll have the weaned calves down on that end and everything will be just fine. No, it won't. No, it won't. Disease processes will build up, germs will build up, and you won't be able to control it because you haven't done the isolation part of disease control. So calves can be raised in groups. We have clients that are using, like I said before, milk bars where there might be 5 or even up to 12 or 15 calves in a pen. Get the calves in, put them in the pen, and they stay in that pen. You don't put in and take out. They are there, and then they are their unit. And they're going to share diseases with each other, but at least they're not sharing diseases with a whole new bunch of calves coming and leaving. And then real important for those calves, if they are being raised in any kind of a group housing, that when there's a sickness going on, you have to devise some kind of an isolation area so that the sick calf is not there exposing the healthy calf to a wide array of germs and sicknesses. Next slide, please. So nutrition on the shipped in calves usually revolves around milk replacer. Just a couple things about how do I know if my milk replacer is a good quality one? I would say to you, talk to others who raise calves to find out what they're using. If you're new to the calf raising business, milk replacer, on the label, on the tag that comes with the milk replacer, there is a description of the ingredients in the milk replacer. Look at that tag, and nowhere on that tag should you see the words soy or wheat. I tell people that both of those are 4-letter words, and we don't use that kind of language when we're feeding calves. And the reason for that is that those sources of protein, while they're inexpensive, actually become expensive because it really sacrifices the nutrition and the health of the calf if there's something other than milk proteins or plasma proteins in that milk. Generally, the better quality milk replacers will have plasma listed as one of the sources of protein. And that's one of the things that the industry has discovered. The cow can't produce that, and yet that added to a milk replacer makes it a much more high quality milk replacer for several reasons, not the least of which is it's a different amino acid profile than what milk is. Feeding needs to be done at regular intervals. Now, that beef cow feeding her calf is feeding that calf 6 or 8 times a day. Ideally, that's what we would do too if we had the time and the ability to do it. More realistically, most calves are fed twice a day. It's an advantage to feed them 3 times a day, but those feedings all need to be spread out fairly equally. And the concentration of the milk stays the same no matter what, and the daily consumption of that milk stays the same whether it's 2 feedings or 3. Calves cannot be fed at a time that's usually convenient for us. I'm sorry, you can't feed them at 9 o'clock in the morning and 3 o'clock in the afternoon and go do other stuff in the morning or the evening. Nope, it will not work. We can cheat it a little bit. Maybe there'll be 11-hour interval one time and 13 the next, but that's about as much as we can cheat it. 10 ounces of milk replacer generally is what is required to maintain the growth and function of the calf. Now, they don't grow much on 10 ounces twice a day, I'm talking 20 ounces in a day's period of time. They won't grow much. It'll maintain everything, and then the hope would be that we've got a quality grain in front of the calf, and that's where his growth and gain and performance will be. Can they be fed more than 10 ounces? Oh, absolutely. The cow feeds a lot more than 10 ounces to her calves. But that needs to be done under control so that you're not feeding more than the calf can handle. And then it also have to look at the economics of it. Those of you who are in the calf raising business as a business will know that you have to be conscious of what the input costs are and the feed costs, and milk is an expensive part of the production system. Water has to be available all the time. Certainly today, when it's 90 degrees outside, they got to have water. If you aren't giving them water, you are cheating those calves badly and are not going to perform and are not going to stay healthy. Calves, when it is 20 degrees above zero, still need water. Not as much in the cold, cooler time of the year, but they still need water. And in some of our chili barns, we have to get creative on how do we get water into these calves when, if it's left standing in front of them, it's going to freeze. There's a lot of ways of doing that. We can help you with those strategies if you need to know how. Water's got to be available all the time. And then quality grain gets offered pretty early in the process. And that is also true for the man who is a dairyman raising his calves. Good quality grain needs to be in front of those calves early in their life. They don't eat much, and they'll mess in it and spoil it, and it gets frustrating in the fact, well, all I'm doing is washing the grain buckets all the time because they're making a mess in it. Go ahead and clean it up. Still keep good fresh feed in front of them, not 6 pounds in front of a little calf. Give him a small portion. When he eats that, he gets a second portion. Kind of like living at home, isn't it? And then we cannot begin the weaning process until they're consuming 3 pounds of grain on a daily basis. If they're consuming 3 pounds of grain, we know that they're consuming enough grain that they are now going to gain weight on that amount, and they'll maintain their body functions, and they'll maintain good health if they're eating at least 3 pounds of grain before we begin the weaning process. And as we talked about on the dairy operation, no hay, no roughage of any kind going into them prior to weaning, but as soon as they're weaned, they should be fed free choice. Generally, just a good grass hay. Alfalfa is usually a little too much, and even if it's just good bright straw, that still is a good roughage for the have, just to have and consume and to balance their diet, so to speak. The environment in these calves, on shipped in calves, again, it's got to be clean, it's got to be dry. The bedding needs to be applied on a regular basis, frequently, to let the pens get real messy and then put a slug of bedding in there. It's wasting bedding, and you're making the calf live in an awful place for a period of time. Small amounts, frequently. And then as a result, you don't use probably as much bedding, and yet you've kept the environment in a healthy situation for a longer period of time. An exchange of air frequently. At least total exchange of air inside wherever that calf is living every 15 minutes. And that means there's going to be air moving. And that's a good thing. In an ideal situation, when you're in a barn, a human being standing in that barn should feel the air hitting them in the face as it's moving. And that's a good thing. It makes you sometimes in the colder times of the year want to pull your hat down around your ears and close up the barn because the air is moving and it's chilly. No. That air needs to move. And it needs to go through there in such a way that it's hitting you in the face. But when you crouch down to where the calves live, because they're not 5 feet, 6 feet tall, when you get down to where the calves are at, crouch down there, do you feel the air moving there? If it is moving and moving fairly rapidly, then you need to do something differently. That's too much. We're creating a draft. However, the ideal situation is you stand in the barn, you can feel the air hit you in the face. You crouch down where the calves are at, and you don't feel the air moving, you got it. That's perfect. And that goes towards having really good health. Giving enough space for the calves. The little calf doesn't need a lot of space. Maybe 12 to 15 square feet is enough space. If it's bedded and we can ventilate over the top of him, it probably is enough square footage, 12 to 15 square feet. As a rule of thumb, 300-pound calves. Now we're talking calves that have been weaned and they're 2-3 months old. Those calves are going to need 30 square foot per calf if they're weighing 300 pounds. And so from 12 as a baby to 30 as a 300-pounder, you need to prorate that as you go along so that those weaned calves have a little more space than they did when they were in the baby calf pens, and we continue to give them plenty of bedding area and plenty of air exchange. And lastly, in these guys, there still needs to be a fly control program where if you're starting your fly control program here at the end of June, you're about 2 months late. That program needed to have begun at the end of April, maybe when you saw the first fly. And we're now doing the things necessary to cut down on the breeding of those flies and the environment, so it's not conducive for fly further breeding and further enhancement of that fly population. So one of the good things that happens with all-out management, the barn gets totally emptied, totally dried out, and those millions of flies that were in there before now have no place to live. With any luck at all, they all come to the kitchen, and now the housewife says, we got to have a fly control program, and now finally it happens. Vaccination of these shipped-in calves, the typical program that these calves are put on calls for a lot of different vaccines, a lot of vaccines. In a perfect world, we wouldn't do all that, but we have to immunize these calves for a couple reasons. We need to do it for themselves, for what's going on in their life as they've come to your farm. Are they exposed to a lot of respiratory disease? Are they exposed to clostridial diseases? Are they exposed to pink eye? And with the experience of working with your attending veterinarian, you can go through the disease processes that are present on the farm where the calves are being raised, and there needs to be immunization programs put in place so that you can help with that. But one other thing has to be thought about is that these calves do not usually stay on your farm. And so if you're doing that, or even if you're feeding them yourself, there's the necessity to look at what diseases are they going to get exposed to as they move. Typically, as cattle get shipped and they land into a feedlot, they start getting respiratory disease. And if the calves have been immunized in our hands when they're babies or 6, 8, 10-week-old calves, if they move to a feedlot when they're 300 pounds or 4 months old, they have some immunity present in them that they can better withstand the challenges of the trip and the challenges of diet change and the challenges of having a lot of diseases waiting on them when they get to a feedlot. Very important to think not only of what's currently going to happen, but think about what's going to happen to those calves as they move on to a feedlot setting. And again, it's farm to farm, case by case, something to work with your attending veterinarian to set up a program. And a lot of it hinges on what vaccines are needed, when do they need to be given, and again, are they actually needed? Medication, unfortunately, there's a lot of disease sometimes going on in these shipped-in groups of calves, and there's need for medicating, but those needs need to be looked at as to whether it's actually needed or not. Let me talk about an example. Crazy hot outside. Shipped-in calves notoriously get a lot of diarrhea diseases. Most of the germs that cause diarrhea are unresponsive to antibiotic treatment. And so in the course of setting up a medication program to treat scours or treat diarrhea in calves, for the most part, if we're giving medication for diarrhea, we're actually making the diarrhea worse because we're trying to treat germs with antibiotics. And those germs will never be affected by the antibiotics in the first place. And so, first of all, the drug is wasted. Second of all, we may be doing harm to the calf using it in a situation where it's not wise. The treatment and the medication then goes back to nourishment and sanitation and everything else. And the change in nourishment is that we will choose to use electrolytes and keep the calf hydrated, keep him balanced. If we do all of that, then the need for antibiotic treatment, medication becomes considerably worse. Next slide, please. So that's a pretty happy place right there. That guy is one happy calf. And we like the picture of that, and we want him to stay that way. We're going to hope that he's got enough space in his hutch there where he's living. We also can see the green grass, so we know he's got a good environment. We hope that that bottle was cleaned up real good in between feedings. We hope that the milk or milk replacer in that bottle is balanced and nutritious, and that it is not a source of further disease and so forth. So a little bit of theory. Let me introduce you to the rest of the calf care team. These are the other 4 veterinarians that work at calf care. One of the things that we in our group that we are very keen on is we want to get to the right diagnosis. My calves have diarrhea. Yeah, and they'll mention a germ. Well, maybe they have crypto. Well, yeah, they probably do. But what else besides crypto do they have? And it maybe means that we have to do an examination to find out what other germs are there through sampling and testing at laboratories. It means seeing the calves and what are you doing and looking at all of that sanitation, isolation, nutrition, environment, looking at all those things. And can we control the health problem that the calves are having based on that? One of my first bosses was a grouch. And he had a lot of sayings that sometimes would make me mad, and sometimes would make me laugh, and sometimes make me roll my eyes, thinking, this old joker. And he had a statement that and he and I were in the truck traveling to go to a farm, and we were going to this farm because there had been some animals die. And on the way out to the farm, he said, the most valuable animal on the farm is the one that just died. Because that animal now gives us the information by which we can know what's going on with the other animals. And so at calf care, oftentimes our only emergencies are to go look at dead calves, because it is from those calves that we can get the best information and the best understanding of what the disease process is. Next slide. So this has hopefully not been a sales pitch that you need to patronize calf care for your calf needs, because I want everybody to see that there is a wealth of knowledge and experience in the other veterinarians that are also servicing Elkhart County. Make note of that. There's a lot of good people at each of those places. So was there ability to do questions?
Allison, do you have any questions for Dr. Jan? Let's see.
I have. You alluded to earlier, was that the Asian Longhorn?
Asian Longhorn tick.
We just got things saying it was about 2 hours north of us in Michigan.
Yeah.
And the interesting thing I thought when I read about that, and then we had a program last February that that Catherine and I were on. Like the females they can reproduce without a male. And
yes,
they were saying they can literally, like, in a very short time, overwhelm an animal and basically kill it. So yeah, that's kind of crazy. But so
it's a whole scary scenario in the fact that the ticks are going to almost 100% be in wooded areas. So these wonderful woods pastures that I think is wonderful for cows to live in, actually right now is not a good thing. The ticks have to have a wooded area to live in. They have to have a blood meal to produce and continue to reproduce. And they get that blood meal attaching to the cow and sucking blood out of the cow or calf. And part of the death loss comes from blood loss as the ticks suck on the cow or the calf. But more importantly, and more deadly, is the fact that they carry an organism for which there is no treatment. The organism gets on the blood cells and causes the blood cells to break and not be effective anymore. And so the animals die from anemia, and we don't have any way to treat it.
I did not realize that. That's why I was curious.
That's the horrible news. The excellent news is those that survive are pretty well immune to that disease evermore. So it'll be a horrible year. There are other tick-borne diseases, mostly south of us. That's always been a south of Interstate 70 thing forever, that the tick-borne diseases in cattle have all been down there. And I had this hope that our weather would be severe and adverse enough that they wouldn't find their way up here, but yeah, they're here. But the understanding that I have of this is that the first year is awful. There'll be death loss, there'll be performance loss, everything will be just not good. And then they develop a carrier state or an immune state to where the following year they're going to be fine if they survived it. Other than the calf crop, then they're susceptible all over again.
So since ticks are not insects, how, like, for treatment or to have a preventative or?
It takes different types of, we'll call it insecticides, but chemicals to kill them. And there needs to be a regular application of those chemicals. And so the dust bag oilers, I mean, age old forever, grandpa used that. Gosh, what are we doing getting back to that? Well, we're getting back to that because there needs to be a regular application of it. And for most beef cow herds, to get them in and spray them once a week is tough. The ideal thing, and I haven't seen one, but it's been presented to us, is that there are devices that's similar to a car wash that the calves and cows will walk through, and they'll be sprayed as they go through this device into their, and you set up a narrow gate so they have to go through it to get into water.
Hey, like today, they may just keep going back and forth.
Or just stand there.
There's an organic dairy farm in this county that he came up with a machine that literally sucks up the flies, gets enough of the vacuum going that it can pull up the flies.
Sucks them right off. The ticks are attached. You're not going to suck them off. So the problem with the dusters, they can be, number one, you can get the chemical on the animals on a regular basis, and that's a good thing because it needs to be regular. The bad thing is really need to get on the underside, because in the armpits and around the udder and so forth, the ticks really like attaching that. Ears, they like to get into ears. And so the dust is a good thing if we had some way of getting it up underneath of them. And for years, we've wished for that because one of the sources of juvenile mastitis, the mastitis that gets into dairy heifers before they ever freshen, has been fly damage on the teat end from fly damage. And so it'll damage the teat opening, and bacteria can get up in the udder through that fly damage. And so there's always been the wish for, if we just had something that we could spray the bottom of animals, almost more important than spraying the top. So,
well, they have the undercarriage at the car wash too, I guess.
That's why I'm saying you gotta run these things through a car wash, but I mean, yeah. So the Asian longhorn tick is a real deal. I was hoping that it was going to stay south of Interstate 70, but if it's north of us, it's probably here.
I can't remember what the town was. I think it was about 2 hours north of us is what the email said from the health
Was it
department.
buried?
Yeah.
No.
Cattle move a lot anymore, and as cattle move, so do the germs, and insects and ticks and everything else.
As in with HP, yeah.
And what?
As with, the same with avian influenza.
Same way with it, yeah.
So with a normal tick, I know I've heard before that it takes so long after they attach to transmit disease. With this one, is that the same or is it supposed to be like a super bug?
I don't know if it's a super bug, but I'm going to say that what they do quickly.
Allison had a couple questions. She asked on the beef calves side specifically, what are the mistakes that you see producers making that result in disease and possibly death?
In beef cow producers, be hard to make a list. To me, as far as the calf crop in a beef cow herd, the death loss is still occurring in the first several days of life. And I know there's market reasons why people do this, but if they can delay calving until a kinder time of the year so that there's not adverse weather as far as cold and such, but moisture is the killer on so many diseases. If the beef cows can drop those calves mid-April and later, where now mud's not an issue, freezing and thawing is not an issue so much, or they can do fall calving where there's a nice dry environment and calf scour and calf diarrhea becomes much less of a thing. And then as far as the calves, if we're going to extrapolate a little bit further, there are good systems and good programs that can be put in place on a beef cow herd where they are, the next couple of weeks are starting to bring the cows and the calves up to where there can be, first of all, insect control. And then they bring the calves up, and it's a good time to begin the immunization process while they're still on mama. If the bull calves aren't cut, it's a good time to cut them. If you're using growth promotion implants on the steers or the heifers that are not being cut for replacement, that can be done. And so you get the health benefits of fly control and immunization. You get the growth benefits of growth promotants. It's a good time to deworm and do the cow herd and the calf crop. And you put them back together and they live, for another 4 to 6 weeks. And then when it comes time to wean the calves, a lot of the stressful things are already done. And as you revaccinate, it becomes a booster type thing so that the death loss and performance loss becomes less of an issue than as they're weaned and head off to feedlots or into the farmer's feedlot. I think those would be the things.
And then she also asked, at what points should they consult professionals? Because a lot of times they notice that calf is struggling and we're quarantined, giving them time to bounce back.
Okay. And I appreciate the term bounce back. Animals have a great ability to heal if we get out of the road. And my clients know that I don't like the term sick pen. I'm maybe not answering your question exactly, but I don't like the term sick pen because oftentimes that's the pen they'll put the animal in so that they can actually get sicker. It's not good air, not a good environment. They're ignored. I like for our clients to set up recovery pens so they can bounce back. They don't have competition. They don't have crowding. They got good air. And they are most easily to get our hands on to medicate if we have to. At what point in time to ask for help? The way the cattle industry is right now today, with the dollars associated with the cattle industry today, the time to seek professional advice is long before you need it. Because we can't afford to have sick ones, we can't afford to have dead ones. Really, we by the time an animal is sick, we've already lost most of the productivity of that animal. We're now trying to catch up. And so I want to put animals to where they're in a spot where they can do that bounce back. I really like that term. But I also want to do everything we can right now so that there's no anything that they have to bounce back from. And I think that's, I mean, in our group, we spend probably more than half of our time looking at healthy calves. And the reason we're looking at them at that point in time is that we go through that long list of boring stuff. You say, well, you know, that's not important. Yeah, we go up and down that long list of boring stuff so that we don't have to get down into the exciting stuff like how do we keep them from dying because they're really, really sick. So the way the beef industry value is right now, intervention has to be early. If they are waiting until they have a sick animal, and if they do have a sick animal, put them in a place where they can bounce back along with the interventions that are being made as far as treatments and such. And then, yeah, let's do the things we can so they don't get sick in the first place.
Prevention's better. What are your thoughts on the New World screwworm that we have in Mexico, basically?
I think it will stay there. And while that's a problem for our friends in the southern states that border Mexico, there's pretty aggressive programs to keep it there. I think the New World screwworm's gonna still stay way south of us. It's not gonna be an issue for us or even for our Kentucky clients. If we lived in Texas, different story.
Okay.
No one's asked about bird flu in cows. And while it doesn't, while what we read says that we don't have to worry about it in calves, have a veterinarian colleague in the Central Valley of California who talks about the horrible things that happen to calves when they get bird flu. And more importantly, the horrible things that happen to dairy cows. It's not just they're producing funny looking milk for a short period of time. They're very, very sick and they are very heat intolerant when they get that. And the scary thing is, if they get it and get over it, they can get it again. And so kudos to those in the offices of our state veterinarian, both the past state veterinarian who implemented very aggressive programs to try to keep it out of Indiana and the folks that are in there now. Best of my knowledge, it's not in the cow herds. Now, it depopulated a lot of poultry flocks and that's serious stuff. But so dairymen need to be conscious of who's coming to your farm, especially if those folks have had some exposure to the poultry industry. If you've got a part-time helper who's doing some milking, but he's a full-time employee at a poultry farm, may want to find him another job to do on the dairy that has nothing to do with the cows and calves. But so far it has not jumped into our Indiana's cow herds, and we don't want it to come.